Hello, my name is Tamika Starling, and I'm going to be doing a case study presentation, number 1, on Mr. Itsuki Dashi. So Mr. Itsuki was a 23-year-old engineering student from Japan. He was referred to his university student mental health clinic by a professor. He wasn't attending class regularly, and when he actually met up with the professor, he revealed that he was distracted by listening devices and thought control machines in his apartment. So during assessment with the psychiatrist, Mr. Dashi was found to be grandiose, with plans of becoming Japan's prime minister and him being targeted because he had superior intelligence. He denies any mood changes and admits to smoking marijuana while in Japan, where he had an episode of hearing sounds and thinking that his friends were laughing at him, but denies any other substance use since returning to the States. Now, he denies any further into the hallucinations. He denies any besides the incidents with marijuana, and except when they try to put ideas in his head. So no further information was provided on that statement, and he still denied all other auditory or visual hallucinations. Mr. Dashi has no family history of mental illness, and all lab results were unremarkable. MRI was normal. Nothing was found on the drug screen. So for Mr. Itsuki, for his diagnosis, the reason why he chose delusional disorder is because it looked like he just exhibited psychotic symptoms and met criteria A, the part for delusions. Now, as far as hallucinations, he only complained of that after he used marijuana. And then also when he states, except when they try to put ideas into my head, as far as his thinking being clear, I would have went into more depth of who is they, because that could just be a part of his delusion of being persecuted and having mind control and mind devices there. Like, if it just pops out of nowhere, is it organic, or is something actually talking to him, i.e. he's hearing voices? So I would need clarification on when he said that one part, which is why I cited on the part of delusional disorder. So here are some differential diagnoses for Mr. Itsuki. Number 1 would be the schizophreniform disorder. Only reason, again, that I did not pick this one, I cited more towards the delusional disorder because I felt that his hallucination had to do with his delusion, and it wasn't really prominent. And then he didn't have really any disorganization or negative symptoms or disorganized behavior. I also found, since he was of Japanese descent, of hikikomori syndrome, which is basically where young adults and adolescents isolate themselves in their families' homes. They don't talk to anybody. They don't go outside. They just do just enough to eat and um, take showers. That is kind of characteristic of the negative symptoms of schizophrenia. And then also we have schizophrenia, which he hasn't exhibited any of these even for over 6 months. Psychotic disorder due to another medical condition, which was ruled out after he got his MRI and drug tests, and schizoaffective disorder, which he didn't have. It didn't sound like he had any mood dysregulation. So establishing trust is essential when for effective psychotherapy, especially in patients with delusional disorder. The provider shouldn't agree or challenge the delusions, but they can certainly be empathetic by saying, you know, I'm so sorry that you're going through this. I'm sure that you are distressed by the situation. Hospitalization, if necessary, can also be a part of the treatment plan for delusional disorder. But for Mr. Itsuki, it probably would not be necessary. He's not posing a danger to himself. He's not threatening anybody. He's just psychotic. And then pharmacotherapy, antipsychotics are the drug of choice. Even though there's not a lot of evidence specifically for delusional disorder, they say evidence finds it reasonable to use antipsychotics because it effectively treats other psychotic disorders. So it's reasonable to use antipsychotics to treat delusional disorder. The rule would be start low, go slow, and might not push the medication as quickly. Maybe establish that rapport first, and then see if you can offer the medication to help with the symptoms. These are my references, and this concludes my case study for Itsuki Dashi. Again, his diagnosis was delusional disorder, and with the treatment of antipsychotics and therapy, I feel that Mr. Dashi could get better. These are my references, and this concludes my case study for Itsuki Dashi. Again, his diagnosis